Hi, my name is Josephine. I'm a nurse practitioner and I'm going to be doing your head to toe physical assessment today. Let me wash my hands. And for the sake of the video, we're going to assume that your vital signs have already been taken, okay? So let me explain what I'll be doing. It's a physical examination and it's going to involve me just touching you sometimes. Will that be okay with you?
Yeah.
And the instructions are simple. Just follow what I tell you, okay? And throughout the video, if you have any distress, any discomfort, please report it to me, okay? So I'm just going to do a general survey. I'm looking at you. You are full-grown, well-nourished adult. I see you are well-dressed, dressed appropriately, and I don't perceive any odors, any abnormal odors. And have you been eating appropriately?
Mm-hmm.
Have you lost any weight without trying in the past 2 weeks?
No.
Okay, so I'm looking at your skin color. It's appropriate to your ethnicity, and I'm just going to touch you to feel for temperature. Your skin is nice, warm and dry, and I'm checking for elasticity, and there's good sugar, no tension that I can notice. I see you have hair that is evenly distributed all over your skin, and also I'm going to check your hands. They're even. Check your nails for symmetry, and your nails are clean. I don't see any clubbing, no cyanosis. I'll check for capillary refill, and it is less than 2 seconds. I'm looking at your head. Your head is symmetrical, and I see you have hair on your head which is evenly distributed. I'm just going to feel for texture, and I'm also going to look at your scalp for any scaling or lesion. I'm palpating for any inflammations or areas of tenderness, especially on the back. And now I'm going to go to your face to check for symmetry. I'm going to go ahead and check for canine F7. So smile for me. Frown. Raise your eyes up and down. Okay, good. Now close your eyes tight. Okay. Now pop your cheeks with air. I'm going to check for strength, and that's good. Now the canine F7 is intact. I'm going to go ahead and check with canine F5. Just open your mouth and close for me. Open and close, and I'm palpating for the TMJ, and I don't feel no tension or clicking sounds. That's normal. I'm going to go ahead and look at your eyes. So I'm looking for any bulging or any sunken. So I don't see any. Your eyelids are even, no inflammation. Your scleras are white. I'm looking at your conjunctiva, and they are both nice and pink, no paleness or redness. I'm gonna go ahead and assess for cranial nerve 2, and I'm gonna use the Snellish chart. I'm just gonna have you from arm's length close one of your eyes and just read the last line for me.
LTFPH.
Now close the other eye and read it again.
LTFPH.
Now read it with both eyes.
LTFPH.
Okay, good. So that's cranial nerve 2. I'm gonna proceed to check your pupils. And this will be cranial nerve 3, 4, and 6. So I'm gonna start by checking your pupils for both direct and consensual pupil reaction to light. I'm gonna shine this light into your eyes, and I'll see the reaction. Okay, just look straight ahead. And of course, when I shine the light, this pupil contract, and both of them contract. And I'm going to do the same thing with the other eye, and both pupils are contracting. Now I'm going to check for extraocular eye movement. I'm just going to have you stay straight ahead towards me. Do not move your head, just follow the direction of this pen, okay? That's perfect. Both of your eyes were moving appropriately towards all the directions. Now I'm gonna go ahead and check for accommodation. Now stare far off. When you do that, it dilates your pupils. Now I'm gonna have you follow the direction of this pen and just look at the way I'm pointing this pen to. And of course, that makes both pupils contract and also accommodate. I'm gonna go ahead and I'm going to proceed to check for, I'm going to go to your nose. Just looking at your nose, I'm checking for symmetry. I see that your nose is even, and no lesions, no drainage. I'm gonna have you close one of your nostrils and breathe in and out for me. Okay, I can feel that it's patent. Do the same thing with the other nose. I can feel the air coming out with this patency. I'm gonna use my otoscope to look at your septum for any deviation and the turbiness. Okay, so I'm just gonna sit down for me. You're very tall. So I'm just gonna look in there, and I see the septum there's pink and no inflammation. I can see the turbinates are all normal, no inflammation. Okay, I'm gonna go ahead and check for cranial nerve 1, which is a sense of smell. So I'm gonna have you close your eyes for me, and I'm gonna put something for you to smell. You tell me what you smell, okay?
Alcohol.
Okay, good. So your cranial nerve 1 is also intact. I'm gonna proceed to your mouth. I'm looking for symmetry, any lesions, any cuts. Now, I'm gonna have you open your mouth for me, and I'm just gonna look in there and see your soft and hard palate. I see there's no lesions or drainage in your mouth. I'm gonna check for cranial nerve 9 and 10 while I'm in your mouth. So cranial nerve 9, say ah. And I see your uvula moving up and down when you say that. So cranial nerve 9 is intact. I'm gonna also check for the gag reflex or cranial nerve 10. For the sake of the video, I'm not gonna do that, but the gag reflex will be positive for cranial nerve 10. Now, I'm gonna go ahead and check for cranial nerve 12. Just have you stick your tongue out for me. Rotate it all over your mouth. Okay, that's cranial nerve 12 is also positive. I'm gonna go ahead and do the ears. So I'm just looking at your pinna for symmetry and any lesions. The canals are also clean, no lesions or anything. I'm gonna go ahead and inspect the mastoid. It's nice, no redness, no inflammation. I'm also gonna palpate both the mastoid. Tell me if you have any tenderness. Okay, so there's no tenderness, but before I proceed with the ear, I'm gonna palpate your sinuses. Okay, so I'm just gonna palpate. Tell me if you feel any tenderness. This is the frontal sinus, the ethmoid, and the maxillary. No tenderness. Okay, so I'm gonna now use the otoscope again to look into your ear. I'm looking at the external ear and the middle ear. Okay, I'm gonna just pull it up and back, and I see that the external ear canal is pink, no inflammation at system cerebrum, and I can see the middle ear. I can see the tympanic membrane, and it's all intact. Okay. Now I'm gonna go ahead and check for cranial nerve 8, and that's the hearing test. So I'm gonna do the Ryan and the Weber test. For the Ryan test, I'm gonna tune this fork and put it on your mastoid, the back of your ear. You're gonna tell me when you stop hearing the vibration, and okay, bring it to the front. And when you stop hearing the vibration, you let me know. Okay?
Okay. Stopped. Stop.
Okay. So of course, air conduction is double bone conduction. So the Ryan test is positive. Now I'm going to do the Weber test. And for the Weber test, I'm going to tune the fork again. I'm going to put it in the middle of your ear. You tell me if you hear the vibration more on the right or the left, okay, or in the middle.
Kind of in the middle.
Okay, that's perfect. In the middle means that the hearing in both ears is equal. So the Weber test is only positive. So I'm gonna proceed to the neck. I'm gonna just inspect the neck for symmetry and see if there's any deviation or any obvious pulsation. I don't see any. I'm also gonna palpate to make sure your trachea is in the midline, which it is. I'm gonna also palpate for the carotid artery right here, and I can feel I'm checking for rate and symmetry, and I can feel it. Palpate again on the other side, the same thing, rate and symmetry, and it's even. Now I'm going to use the bell of my stethoscope to palpate for bruit, and I'm gonna do that on each side of the carotid artery, and I didn't hear any, and I didn't hear any. So I'm gonna while I'm on the neck, I'm gonna check for cranial nerve 11. So I'm just gonna have you stroke your shoulder against my arms. That's pretty strong. Now turn your head against my hand, do it on this other side. So that's pretty strong. So cranial nerve 11 is positive. I'm going to proceed to do the chest and lung exam. So for this one, I'm not gonna have you take off your shirt, but I'm just checking for symmetry, for any deviations, any use of other muscles for breathing. I'm gonna check both the anterior and posterior chest to look for the AP diameter. I don't see any barrelness, so the AP diameter is normal. I'm gonna, for the sake of the video, I'm just gonna show where I'll listen to the long sounds without doing the full cycle, but I'm gonna have the patient breathe in and out for me. I'm gonna listen here, 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 here. Okay. I'm also gonna percuss the long sounds, and I'm expecting to hear resonance, and that's what I can hear. Okay, and now I'm gonna check for tactile fremulums. When I place my hand on your chest, you say 99, okay?
99, 99, 99.
Okay, so that's perfect. I'm gonna appreciate the vibration on all the fields, so that's normal. I'm gonna have you stand up now because I do the posterior chest. So same thing, I'm checking for symmetry, any deviations on the back. I don't see any. So I will start by listening to the long sound, and I'm just gonna show where I will listen. Okay, so that will be the long sound, and now I'm gonna percuss the long fields for resonance, for resonance. Okay, that's perfect. Now I'm gonna check for tactile fremulums again. When I place my hand, you say 99, okay?
99, 99, 99.
And I can hear the vibrations on all the fields. Now I'm gonna go ahead and check for respiratory excursion. I'm gonna have you take a deep breath for me, okay? But I'll tell you when. Okay, take a deep breath. Now release. And this one I'm checking for even movement, expansion and contraction of my thumbs when you inspire and expire, and that was even. Now I'm going to check for diaphragmatic excursion. I'm going to have you take a deep breath and hold it, and then when I tell you to release, you release and hold it, okay? So take a deep breath. And I'm going to percuss until I get the area of dullness, and then I'll mark it and have you to exhale and hold it. Okay, and then I'm gonna percuss again until I get the area of dullness right there. So your diaphragmatic excursion diameter is about 4 centimeters. The normal is 2 to 5, so that's normal. Now I'm gonna go ahead and have you sit down so that I can do the cardiovascular exam. I'm gonna start by checking the major pulses, and that will be the radial pulse, checking for symmetry and rate. Seems normal. I'm gonna check for the brachial pulse. I'm gonna check for the popliteal pulse right here, and the same thing on the other leg. I'm gonna check for the pedial pulses right here, and then I'm gonna check for the posterior tibialis pulse right here. I'm gonna go ahead and listen to the major cardiac valves. I'm just gonna show the positions where they are. I'm gonna start with my diaphragm. I'm gonna listen to the pulmonic valve right here, the aortic valve, Erb's point right here, tricuspid valve, and mitral valve. And I'm gonna palpate the point of maximum impulse, which is on the fifth intercostal space and the mid-clavicular line right here. And then I'm gonna go ahead and listen to those heart sounds again with the bell of my stethoscope, and I'll be listening for any bruit. So here, pulmonic, aortic, Erb's point, tricuspid, and mitral. Now I'm gonna proceed and have you lay down for me, and we'll do the abdominal exam. So in the abdominal exam, we are looking for like any stripe, any scars, any obvious rashes, any herniation, and I'm gonna proceed and auscultate all four abdominal quadrants. And I'm listening for the bowel sounds. They're all present. Now I'm gonna percuss the all four quadrants too, and I'm supposed to hear resonance. Now I'm gonna go ahead and use the bell of my stethoscope to listen to breathe on all the major valves in the abdomen. Okay, and the aortic valve, I'm gonna listen to it right here. The left renal, the aortic artery right here, left renal artery, right renal artery, the right iliac artery, left iliac artery, left femoral artery right here in the inguinal space, and right here. Now I'm going to palpate the all four abdominal quadrant. I'm going to do light palpation, and then after that I'll do deep palpation. So just palpate lightly for any masses or any areas of tenderness on all four quadrants, and then do deep palpation, 2 on all four quadrants, and I didn't feel anything. Now while you are laying down, I'm gonna check for some cerebral function. I'm gonna have you put your heel to your knee and just slide it down. Just slide it down. Sorry. And do it again. Okay, slide it down. Do it like twice. Okay.
Are there a breathing treatment for 30?
Yes. Okay. And now I'm gonna have you stand back up. And we're gonna continue with the cerebral function. We're gonna do some quick movement, okay? I'm gonna have you touch my finger and touch your nose. Do it again. Repeat it quickly as fast as I can. Okay, do it with the other hand. Okay, good. I'm gonna have you place your hands on your thighs, flip them back and forth. Okay, that's perfect. Now while we're standing here, I'm gonna have you do a shallow knee bend for me, just like that. Okay, that's good. Now we're gonna do something called a rhombic sign. For this one, I'm gonna have you put your feet together. Now, you're gonna close your eyes, and I'm gonna be right here. If you lose your balance, I'm gonna catch you, okay? So put your arms out, palms facing up. Close your eyes, okay? Okay, that's perfect. Now you can open your eyes. Okay, I'm gonna have you sit back down, and we're gonna do some deep tendon reflexes, okay? So I'm gonna start with the bicep reflex. I'm just gonna have you relax your arm for me. Really relax. First of all, flex your arm for me. Okay, now relax all the way. So I'm expecting to see a reaction when I hit it with the reflex hammer. Okay, there you go. That's a wonderful reflex. Now I'm gonna check the tricep reflex. Just really put your arm limp. Okay, and I'm gonna hit right here. Okay, there you go. That's the tricep reflex. I'm gonna check for the brachioradialis reflex right here. Just relax, like right where you are. Okay, there you go. And I'm gonna do the patellar reflex right here. Just really relax your knees all the way. There you go. That's the patellar reflex. I'm gonna do the Achilles reflex right here. I'm just gonna put my hand on your foot, relax your foot all the way. Like really relax. And when you have shoes on, so I might not get it. But that's the Achilles reflex right there. And now you have shoes on. But can I take off shoes?
Yeah.
Okay. So I'm gonna do the Babinski and plantar reflex, and I'm just gonna right. I can't really see because you have socks on, but yeah, if you have your toes curling, that's a positive Babinski reflex. You can put your shoes back on. Okay, so those are the reflexes. I'm gonna have you stand back up, and we're gonna continue the cerebral function. Now I'm gonna have you just walk over there normally. I just want to check for your gait. Walk normally. Perfect. Now come back walking heels to toes for me. Okay, that's perfect. Now I'm gonna have you walk back over there with your heels. That's perfect. Now walk back with your toes. Okay, that's wonderful. I'm gonna check for pain sensation, and I'm gonna use This is what I'm gonna use. This is a dull object and this is a hard object. So this is how a dull object feels and this is how a sharp object feels. You're gonna close your eyes for me and tell me if you feel a dull or sharp pain. Okay. Now if you feel dullness or sharpness. So tell me if it's dull or sharp. Close your eyes.
Sharp.
No.
Dull.
Okay.
Sharp. Sharp. Dull. Sharp. Dull.
Okay.
I have pants on, so I can't really tell. Sharp. Sharp.
Okay.
Sharp. Sharp.
Okay. Now I'm gonna check for can you take off your shoes for me? Because I have to check for vibration. And then you take your socks off too. Okay, so this is it.
Both socks?
Yeah.
Sorry.
So I'm gonna check for I'm sorry, no.
No.
So I'm gonna use this tuning fork to check for vibration. Just tell me if you can feel the vibration, okay?
Okay. Yes. 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 Yes.
Okay, that's perfect. Now, I'm so sorry. Can you put on the shoes without the socks?
Yeah, that's fine.
Okay. So we're gonna check for range of motion on the musculoskeletal system right now.
Okay.
So I'm just gonna start with your neck. Bend your neck front and back for me. Now side to side. So that's range of motion on the neck. And I already checked for strength with the cranial nerve 9, cranial nerve 11. I'm gonna have you check for range of motion on your spine. So I'll have you twist from side to side. Now twist your spine all around. Bend forward, backward. So that's spine range of motion. And I'm gonna have you check range of motion. I'm also gonna check your shoulders for the joint, inspect the joint, and then have you turn your arms rotate your arms all around for shoulder joint movement. Okay, now I'm gonna check for strength. Put your arms out, and I'm pushing down for strength on the shoulder joint. Now I'm gonna have you, this is the elbow joint, and I'm gonna have you check range of motion by putting your contracting, flexing and contracting your elbows. That's good. And I'm gonna check for strength. Put your arms like this. Very cool. Okay, that's pretty strong. Now I'm checking the wrist joint. Now I'm gonna have you push my hand. This is checking for strength. Now put them like this. Put your hands like this. I'm checking for strength on the wrist joint. That's pretty good. Now rotate your wrist around. Put them back and forth like this. Okay, so the wrist is fine. Now I'm gonna check range of motion on your knee, on the knee joint. How to also massage it. It looks normal. Now bring it up, down, or the other one. Now kick forward, back. Okay, now you can lay on the bed. Let's do the rest of it. And also the hip joint. I'm checking for range of motion on the hip. And bring your leg all the way up, down, or the other one. Now rotate your hip around. Do it on the other side. Okay, now abduct, like put your knee back and forth, put your leg out and then in. The other one. Okay, good. Now I'm gonna check for range of motion on your. I'm gonna take your shoe off again. I'm gonna check on the ankle joint. I'm gonna have you like pull on my hands. Now push. Okay, that's pretty strong. Now rotate your ankles back and forth for me. Okay, put them forward, backward. Okay, that's good. Now I'm gonna have you raise your leg up. Raise it, put it out, straight it out. I'm gonna have you push against my hand. So that's strength on the hip joint. And do the other one. So that's checking strength on the hip joint. That's good. And we did the knee already. So I think that concludes the physical assessment. Thank you very much, Noah, for your cooperation here.